Welcome to Redeye. Today we are joined by Scandinavian ChemoTech, and we have two representatives from the company, Nick and Mohan, the CEO. And we're going to talk a bit about the last year and then some priorities and some changes that has happened in the organization. So welcome to both of you.
Thank you so much.
Yeah, thank you, Martin. Thank you.
And Mohan, if you would just like to begin by kind of reviewing what has been the main highlights over the past year or so.
Thank you. Absolutely, I have to start with the fact that ChemoTech has gone from I would say, a slightly opportunistic sales approach where we have, taking the opportunities out in the marketplace to create a few sales, to where we are today, where we have consecutive quarters by growth in revenues. We have also established I would say, a significant part of sale of kits in the animal care sector, as well as we have struggled a bit with the clinical project in our clinical trial in aims of identifying patients, but have started to come up with numbers again after a little bit of reorganizations in the university hospital, as well as some other facts that sometimes is hard for us as a company to predict. But it feels that we are on the track there today. But number one is that we're starting to cover quite a significant part of the burn rate, and we're looking forward now to continue a strategy to take us to a cash flow positive reality.
Great. And I guess on the back of this traction, you announced a few weeks back that you were doing some organizational changes. So you're focusing, as I understand it, more on the animal care, where you see sales traction right now, and then you're kind of down prioritizing human care for now. Can you briefly explain these changes? Kind of what are you doing and what do you see this leading to?
When it comes to human care, I think everybody out there knows that working in human care takes a lot of resources when it comes to the way you have to work. We call it in our world the regulatory framework, and to create and work according to that and serve a market that don't necessarily need to come to exactly that level. It's very costly from administration and logistic perspectives, as well as we're losing a little bit of our speed when it comes to veterinary care. So by shifting our focus slightly, as we see the animal care business growing, we feel that human care administration is taking too much of the resources that actually would be better to allocate towards revenue generating activities in animal care. So what we are doing, in no way are we downgrading our view of the human care business and the potential we have in India. It's still huge. It's just a matter of we are still pretty small as a company, and we have to choose where to allocate our funds and our time in, and we have chosen now to take the step to invest more of it in the area where we see prediction of growth in revenue, and also that could take us to cash flow positive situation. So the only thing we do is actually we're pushing the human care opportunity slightly forward and continue concentrating on clinical work with the trial in aims in Jodhpur in India, for example. And the rest we reallocate into animal care operations and sales and marketing and optimizing the opportunities there.
Great. And I mean, from the market's perspective, that is always a good thing, trying to reach profitability and then be in control of your own fate in a sense, where you can decide how much you want to reinvest. You say that there is about 2 to 3 million SEK in cost savings related to this change. Could you go into a bit more detail, kind of what do these cost changes entail?
Yes, I can. Just by reducing the administration and framework regarding the regulatory aspects of working in human care framework towards animal care, By reducing that, we save alone around 2 million. And by reallocating the staff from certain part of the area that has been more oriented to human care over to veterinary or animal care, gives another approximately 1 million in savings.
Great. And from a later announcement, we learned that the animal care segment is looking at it at a standalone basis. It's profitable for 2024 or cash flow positive. Could you talk a little bit more about the burn rate? Kind of how is this allocated between the two segments as of today?
Yeah, since till today, we have worked with most of the operation within Scandinavian ChemoTech AB, which is the Swedish entity, and also the mother of the entire operation. We had to reallocate approximately how much the different staff have worked towards generating what we're generating in animal care today. And that exercise has not been made in the past, as we don't have different P&Ls. So by giving an underlying data towards our decision of separating the businesses, we're starting to do this, I would say, simulation. What would that happen? And we actually did it to predict how 2025 look. But instead, we're starting as well, looking backwards and saw, wow, actually, with the right resource allocation into animal care, we still did positive cash flow already 2024.
Great. So that is, of course, very good progress in the animal care segment.
Yes, indeed. And it shows that the board has really taken the right decision here in our perspective. And we feel more comfortable of actually also going forward with this in full speed.
And kind of how should investors think about the progress in human care? You say that you're pushing it forward with like 12 to 18 months, but how should investors view the continuous progress in human care?
First of all, I believe that investors should look at that their money that they have invested in ChemoTech is not being risked into still, what I would say, a little risky human care business, because human care are associated with higher risk, both clinical risk and commercial risk. Because everybody knows that even though we are quite certain that we'll have a good clinical trial in AIMS, since we have treated already over 400 patients with IQwave, with a very high percentage of successful treatments. But it's still a trial that needs to go through its process, and hopefully it ends out well. But even with that, there's still administration and clinical risks that the scalability of launching it will not go to the speed we expect it to do, just because human healthcare is not always adopting the best product. There are other barriers as well that we have to pass, and they are associated with risk, absolutely. But when we pass those, the multiple is, of course, really, really high. But the investors' money is being now reinvested into animal care, where we see that the commercial and clinical risk is almost already deleted. We have success, and it's just a matter of how much success can we get in the next few quarters and years, and how much positive cash flow can we generate from that. And that money we can reinvest in the more uncertain human care operation.
Great. And just to be clear for investors, then the AIM study continues, and it's kind of unchanged from this announcement, right?
Absolutely. I had the honor to visit AIMS in December, where we treated a couple of patients in the trial, and we continue the conversation and relations with AIMS with not affected at all to these decisions. This is our priority, number one in human care, and we'll continue. And I think as well, we also have good opportunities to continue growing the relations with AIMS, not only with this trial, but continuing afterwards.
Great. And a question for you then, Nick, if we move over, kind of what is the current organizational status in the US primarily? And perhaps you could give a brief introduction to yourself, just for investors who might not be aware.
Yes, thank you, Martin. So I've joined the organization as part of the board a little bit over a year and a half ago. And also I'm involved with operations in the US as recently as middle of the year last year, coming from a 30-year background in the healthcare industry on the human side. To answer your question on the status of the organization on human care in the US, I'll go on twofold, where we are today and what we're thinking for next year, 2025. So a lot of the steps we've established last year were groundbreaking for us. First of all, we built on a very strong base of customer-centric R&D. Our products have been developed for and by people that know oncology in human and veterinary. So we want to build on top of it. And last year, I'll go with the milestones that we've had. First of all, the first one is record-breaking sales quarter after quarter. Our official numbers for the year are not out, but you've seen our recent announcement on pro forma profitability for animal care. So the lagging indicator of sales, what we ultimately are measured, is going in the right direction. This is for us a very good sign. The second one is it's a good testimony that the confidence from our customer is growing. If sales is there, it's not only devices that we're selling, it's also the treatment kits that are used with each and every animal. And we might address this more specifically later in this interview. So both model of devices and the kits that are used for animals are going in directions, which means that the community has more and more confidence in our technology. And the last one is really the fact that we're spending our time thinking strategically with KPIs and discipline measurement. So with this on a monthly basis, our management team looks at it and we can course correct, because like every plan, there are things that will not work, but we're very agile in adjusting our strategies and tactics. So that's for 2024. If I look at 2025, we have established a very solid strategic direction. And I'll give good example. The first one is selling more devices. This sounds like very simple. We need to have more sites. What we've developed last year is we got into more states, larger states. As an example, we have some press releases around Texas, around Colorado. Those are large states where there are a large number of animals, incidents of the disease we're treating, but also there is wealth into those states that can afford the kind of technologies we are selling. So increasing our device penetration is key. The second part is, if you look at our current users, our current customers that have bought our devices, the usage is going about, let's say, four treatment kits per month. I'm giving you as an example. So our objective is to devote more time to increase usage in the clinic there. Not so much from a financial perspective, it's also from an animal perspective. They bought a very high technology, very good technology, where there are numerous indications that they can use the technology with. And by being present with our customer, we can talk about best practices that are happening within the community of users. And that way they can find more indications to use our technology rather than more expensive routes that they might consider or the patient cannot afford. And Martin, I'll give you an example in terms of the numbers that it could mean. I won't use precise number, but just to give something that gives an imagery. If you have 50 clinics that are using four kits a month in terms of treatments, and you multiply it by 12 months, at the cost of our kits of $400, it's $1 million. Right? This is only 50 clinics using it once a week. So from a revenue perspective, it helps the organization to generate more volume, but also from an animal perspective, because this was one of your questions. What is the part of the revenue that is generated by the treatment kits? I might tackle this one at the same time. Well, the treatment kits are there, and the reason why we built the model on single use is we want the animals to be treated exactly like the humans are. which means that when you use a kit for your own animal, you wouldn't want your animal to know that, or the owner to know that it's been used on a previous animal. So it's for precision. It's a high technology. So the needles needs to be perfect every single time. They need to be precise every single time. So that is why our model in this environment of clinical treatment need to be sustainable and replicable every single time. So to summarize strategy next year, more device and increased usage in terms of number of indications where our product is used. And devoting resources. We're not increasing more resources. We are allocating our resources more towards selling devices and a portion also to supporting our current customers.
Sounds great. Thank you for that, Nick. And if we return to you, Mohan, kind of for the coming years, if we look more broadly, where do you see ChemoTech going now with these changes?
Yeah, first of all, our target is to be independent from the need of continuous share issues. We want to create a revenue and profit generating organization and business, and use our own business cash flow to reinvest in different areas. Obviously, to aggressively restart the human opportunity in India is our main focus still in the near future. But we also will continue drive the tumor-specific electroporation, our unique innovation, towards new areas where we both for animals and for human can benefit this therapy, and a therapy that shows almost zero side effects for the patients. In more advanced treatment modalities, we have before talked about making laparoscopic technique with this, finding partners who can, together with us, make TSE reach tumors that are much more complex and treat, and also where the side effects of previous techniques and modalities of treating cancer, like radiation and surgery, might not even be possible. So I would continue with the long-term strategy that we always had, is to create a new paradigm in cancer care using the platform of TSE and bring it in together with new partners and new techniques to reach more tumors in more patients in more countries.
Great. Thank you very much. That was all the questions I had. Thank you so much for your time today, both of you.
Thank you so much.
Thank you, Mark.